you for joining this discussion about diabetes and prediabetes. Many of us are affected by diabetes or prediabetes, and most of us have family members or friends who have been diagnosed with diabetes or prediabetes. It has been described as reaching epidemic proportions in our state and across our nation. It is important and urgent that this is addressed and that we all try to understand ways to prevent and control diabetes. My name is Alexis Laprelle. I am a second-year health promotion graduate student. I'm also an intern and employee at the Lexington-Fayette County Health Department. The purpose of this presentation is to inform you and other community members about some diabetes prevention and control basics. We will discuss some small steps you can take to prevent or delay diabetes, or if you're a person with diabetes, some small steps you can take to control it to help prevent long-term complications of diabetes. I will also provide some resources where you can find more information and education related to diabetes and prediabetes. So what is diabetes? Diabetes is a disease in which the body does not produce enough insulin, the insulin does not work properly, or a combination of both. Insulin is a hormone that is used to help move glucose or sugar from the bloodstream into the cells of the body where it is used for energy. Sometimes you may hear the term glucose or blood sugar called sugar or blood sugar. We will use these two terms interchangeably. Diabetes is dangerous because it causes the blood glucose to get too high, and this can cause tissue and organ damage. So how is diabetes diagnosed? A normal fasting blood glucose is a blood glucose less than 100 milligrams per deciliter. Diabetes is diagnosed when a fasting blood glucose is greater than or equal to 126 milligrams per deciliter. There are other tests that can be done to diagnose diabetes in addition to fasting blood glucose testing. This includes oral glucose tolerance testing. It is a test in which you have your blood sugar checked prior to drinking 75 grams of a sugary liquid, and it's checked again 2 hours later. If it is greater than or equal to 200 milligrams per deciliter, then that is a diagnosis of diabetes. Another test is called the A1C. This test measures a 3-month average of blood glucose levels. An A1C greater than or equal to 6.5% or more is a diagnosis for diabetes. There is also a random blood sugar test in which it does not matter what you have eaten. In a blood sugar test, a random blood sugar test greater than or equal to 200 milligrams or greater, milligrams per deciliter or greater, is a diagnosis for diabetes. You might be saying, you said normal is 100 and diabetes is 126. What about the blood sugar levels in between 100 and 125? Well, that is prediabetes, a blood sugar level higher than normal but not high enough to be diabetes. Prediabetes is diagnosed when the blood sugar is between 100 and 125 milligrams per deciliter. Just like diabetes, oral glucose tolerance tests can be conducted to measure whether there is a person has diabetes. An oral glucose tolerance test of 140 to 199 milligrams per deciliter is a diagnosis for prediabetes. An A1C of 5.7 to 6.4% is also a diagnosis for prediabetes. There are primarily two types of diabetes that we talk about, and they're simply called type 1 and type 2 diabetes. We used to call them juvenile or adult onset diabetes, or insulin and non-insulin dependent diabetes. Both of these names don't usually describe what's going on exactly, but over the last several years, we found that more people are getting type 2 diabetes during childhood, and it is possible for adults to get type 1 diabetes. Mostly type 1 is diagnosed in children or young adults, and type 2 is mostly diagnosed in adults. Gestational diabetes is diabetes that first occurs during pregnancy. It goes away after the baby is born. Gestational diabetes is a health concern because it increases a woman's likelihood of developing type 2 diabetes in the future. For each type of diabetes without treatment, glucose builds up in the bloodstream, posing risk for adverse health outcomes. So type 1 diabetes occurs in about 5 to 10% of all cases of diabetes, and there is no way that we know of to prevent it. It is an autoimmune disorder in which the body attacks the pancreas, inhibiting its ability to produce insulin. There are also genetic and environmental factors related to type 1 diabetes. With type 1, since the pancreas does not produce insulin, insulin must be administered by injection or an insulin pump to survive. Type 2 diabetes occurs in 90 to 95% of all cases of diabetes and can largely be prevented. Your body still makes insulin, but it does not make enough insulin, and it doesn't work well enough to transport sugar to the cells where it is used for energy. Gestational diabetes occurs in 4% of all pregnancies. Pregnant women take a glucose test during their 24th and 28th week of pregnancy. Gestational diabetes is a concern because it leads to high birth weight in infants. This can cause injury and complications during pregnancy. High birth weight in infants also increases the risk for childhood obesity and type 2 diabetes later in life. 5 to 10% of these women are found to actually have type 2 diabetes, and 20 to 50% of these women will develop type 2 diabetes within 5 to 10 years. Diabetes is an epidemic not only in Kentucky, but also nationally and globally. There are over 30 million people with diabetes in the United States. That is about 1 out of 10 Americans. 1 in 4 do not know they have diabetes. Data from the Kentucky Behavioral Risk Factor Surveillance Survey shows that from 2000 to 2016, diagnosed diabetes among adults has more than doubled from 6.5% to the current rate of 13.1%, or close to 450,000. 1 in 3 American children born in 2000 and after will develop diabetes if this trend continues. It is estimated that it will be 1 of 2 among children of color. Over 84 million Americans have prediabetes, which includes 1 million Kentuckians. That's 1 out of 3 Americans, and 9 out of 10 do not know they have it. Remember, prediabetes is higher than normal blood sugar levels, but not high enough to be diagnosed with diabetes. Prediabetes increases your risk for type 2 diabetes, heart disease, and stroke. So what are the causes for the increase in diabetes? It is thought that there are a number of different reasons for this increase. One reason is the proportion of American adults ages 20 and older who are obese. The percentage of young people who are overweight has more than tripled since 1980. Body mass index, or BMI, is a number calculated from a person's height and weight. BMI provides a reliable indicator of body fatness for most people and is used to screen for weight categories that may lead to health problems. A BMI between 25 and 29.9 is considered overweight, and a BMI of 30 or greater is considered obese. Inactivity is another reason. More than 50% of adults do not get enough to get the health benefits, and 25% report not getting any activity at all. Only in America will we take the escalator to get to our exercise facility. Poor eating habits is also a reason for this increase, taking into consideration what we eat as well as how much we eat. African Americans, Latino, Hispanic, and American Indian Alaska Natives are at a high risk of developing diabetes. Also, certain regions and cultural groups have a higher risk. Age. The longer we live, the more likely we are to get diabetes, considering that aging alone is a risk factor for diabetes. Though there has been an increase in rates of people diagnosed with type 1 diabetes, the cause is unknown. There has been an increase among all ethnic groups, but the biggest increase has been among Hispanic youth. There are some factors that increase your risk for developing diabetes. Some of these risk factors, such as the ones marked by the stars, including family history, race and ethnicity, and age. These are non-modifiable risk factors, meaning we do not have control over them. But there are some factors such as weight and physical activity that we do have control over. So how do I know if I'm at risk for developing diabetes? You can take a the CDC pre-diabetes screening test. If you want to get tested for pre-diabetes and you have individual or group health insurance, see your healthcare provider. If you don't have a healthcare provider, ask your insurance company about providers who take your insurance. Deductibles and copays may apply. If you have Medicaid, see your healthcare provider. If you do not have a healthcare provider, contact a state Medicaid office or contact your local health department. If you have Medicare, see your healthcare provider. Medicare will pay for the cost of testing if the provider has a reason for testing. If you do not have a provider, contact your local health department. And if you do not have insurance, contact your local health department for more information about where you could be tested or call your local health clinic. You can also go to the website for the CDC at www.cdc.gov/diabetes. So there are signs and symptoms associated with type 2 diabetes, including excessive thirst, excessive hunger, frequent urination, unexplained fatigue, blurry vision, sores that will not heal, and dry and itchy skin. Sometimes people do not have symptoms at all, and they are very surprised when the results of their blood tests come back high. This is one of the reasons why getting tested is so important. There are some general guidelines that you can follow if you're wondering whether you should get tested. If you begin to display signs or symptoms of diabetes, you should get tested. If you are older, if you're 45 and older, if you are overweight with one or more risk factors, you should get tested. Follow up with your healthcare provider every 3 years if your test comes back normal. Follow up with your healthcare provider once a year if you are high risk or if you're diagnosed with prediabetes. So as I mentioned before, diabetes can cause damage to the body. Poor control of diabetes, including blood sugar, blood pressure, and cholesterol, can lead to several complications. Diabetes is the 6th leading cause of death by disease in Kentucky, and these complications include heart attack, stroke, or cardiovascular disease, eye disease that can lead to blindness, kidney disease that can lead to kidney failure, lower extremity amputation, nerve damage, complications during pregnancy, dental disease, and an increased likelihood of catching diseases such as the flu and pneumonia. While this may seem scary, the great news is that diabetes is controllable. There is a lot you can do to decrease your risk of complications if you have diabetes, and there is also a lot you can do to prevent type 2 diabetes if you are at high risk. So what do we mean by controlling diabetes? Some may say it's easy as ABCs. It's not always easy, but remembering the acronym ABC can help you remember how to control your diabetes. The A stands for A1C. The goal is for the A1C to be less than 7%. Sometimes your healthcare provider may suggest a lower A1C or a higher A1C. The A1C is a blood test that shows your average blood glucose over the last 3 months. For example, an A1C of 7% gives you an estimate average glucose of 154 milligrams per deciliter. A1C is important because it is the best indicator for your risk for diabetes complications. In a study conducted in 1994, the Diabetes Control and Complication Trial, it showed that lowering the A1C from 8 to 7% decreases the risk of diabetes-related eye disease by 68%, and the kidney disease and nerve damage by 38%. The B stands for blood pressure. Blood pressure is very important to control as well. High blood pressure increases the risk for heart disease and stroke and eye and kidney problems. A normal blood pressure is less than 120/80. A goal for a person with diabetes is to be controlled at less than 140/90. And then sometimes the C stands for cholesterol. Cholesterol control is important in keeping your blood vessels healthy to help prevent heart disease and stroke. Sometimes we use the S in the ABCs. The S stands for self-management education and stopping smoking. Managing diabetes and care includes nutrition, physical activity, taking diabetes medications, monitoring important values like blood glucose and blood pressure, and working to prevent long-term complications. Taking care of your diabetes can be overwhelming and there's a lot to learn. Being part of a diabetes self-management education and support program, or the DSMES, can be very helpful to the person with diabetes. The person learns ways to control diabetes and reduce risks for long-term complications. The DSMES includes information on healthy eating, being active, taking medicine, monitoring blood sugar and blood pressure, problem solving for high and low blood sugar, taking care of your feet, and other ways to prevent problems and developing healthy coping skills. Also, a very important resource for persons with diabetes is the medical nutrition therapy, or MNT. MNT is an opportunity for a person with diabetes to work with a registered dietitian to develop an individualized nutrition plan. This is a covered benefit for a person with diabetes on Medicare, Medicaid, and many private insurance plans. Again, joining the DSMES will provide guidance on how to take care of diabetes and how to reduce the risk for developing long-term complications. You should greatly consider joining a DSMES program upon your first diagnosis once each year to review where you are with your diabetes self-care. So if you have a change in care, such as a new doctor or new medicines, and if you are experiencing a new diabetes complication. The Kentucky Diabetes Resource Directory is a great source of information about where diabetes self-management support activities are offered in the community. The directory is an online tool that covers the whole state, but can be filtered by county, and I will show that to you a little later. So as I already mentioned, it is estimated that 84 million adults in the United States have prediabetes, and we have also discussed that type 2 diabetes can mostly be prevented. I like to say that prediabetes gives you a window of opportunity to prevent or delay the development of diabetes. A very important study showed that eating better, exercising regularly, at least 30 minutes or 5 days per week, and modest weight loss can prevent or delay the development of type 2 diabetes in a person who is high risk. Many times people get frustrated with weight loss, thinking they have to lose so much weight and there would be no way. Think about it this way: a person who is 200 pounds, losing 5 to 7% of their body weight means losing only 10 to 14 pounds. That alone decreases the risk for developing type 2 diabetes. From that study, an excellent program was created, the Diabetes Prevention Program. Other studies have shown that these 3 strategies, such as eating better, being more active, and losing weight, significantly reduces the risk for cardiovascular complications or your risk for a heart attack or stroke, both of which are higher in people with prediabetes and diabetes. So eating healthy is an important factor for people trying to prevent diabetes or people with diabetes. These are some important tips that can get you started. You should select various healthy foods, practice portion control by opting for reduced portion sizes, eat regularly and not skipping meals, increasing your intake for whole grains, and choosing non-starchy vegetables. You should also choose low fat or low sugar options, consume more water, reduce your sodium intake by replacing salt with herbs and spices, and altering your recipes to decrease sugar and fat. The recommendation for physical activity for adults is at least 30 minutes for 5 days per week. If you are unable to exercise for this duration and frequency, then start slowly and build up to this level of exercise. You may need to check with your doctor or healthcare provider before increasing your activity level if you have heart, breathing, or joint problems. We know that in addition to diabetes prevention and weight loss, physical activity decreases your risk for heart disease, decreases your risk for some cancers, strengthens bones and muscles, and improves your mental health and mood. Among people at high risk for developing type 2 diabetes, structured programs that emphasize lifestyle changes work well to reduce the risk for developing type 2 diabetes. Those that include moderate weight loss and regular physical activity, along with healthy eating strategies like decreasing calories and monetary dietary fat, can help. Great news about these strategies for diabetes prevention is that they also help you control diabetes as well. Slowly losing weight leads to a more sustainable weight loss. If you have prediabetes, have had gestational diabetes, or at a high risk for diabetes, talk to your doctor or a diabetes prevention program provider or DPP provider about joining a DPP program. If you have a Kentucky Employee Health Program or state insurance and qualify for DPP, you may attend at no cost. Medicare covers DPP. Go to the Kentucky Diabetes Resource Directory to find DPP classes available to you. So if we take action now to prevent and control diabetes by remembering to practice healthy eating habits, exercising regularly, managing our weight, and to get our blood glucose checked if we are 45 and older or at risk of diabetes, we can control and tackle this epidemic. Again, if you have prediabetes or a high risk for diabetes, go to the diabetes prevention program. And if you have diabetes, participate in a diabetes self-management and education and support program at the recommended times. You can also use the Kentucky Diabetes Resource Directory to find diabetes resources available to you in your community. This is the Diabetes Resource Directory, and I will show you the home page. So if you pull up the link and go directly to the home page. So this is the home page for the Kentucky Diabetes Resource Directory. And obviously, if you click here, it'll pull up all the different resources that are available. So if I am interested in a diabetes prevention program, if such as being a person with prediabetes or being high risk for prediabetes or diabetes, I can select this option and I can click search. And as you see here, all the different diabetes prevention programs by county will appear. And if you click more, you can find more information about that particular program. But as you can see, that is all organized by county, and there are plenty of resources available to you. So that is all I have for our diabetes and prediabetes discussion. Together, we can work towards understanding and preventing and controlling diabetes, and it'll take one person at a time, but we can do it. Thank you for joining this discussion, and I hope you have a wonderful day.